Head positioning. Welcome to our airway management simulation training with Smart Airway, focusing on head positioning techniques. A proper head positioning is crucial for maintaining a clear airway and facilitating effective ventilation in patients experiencing respiratory distress or undergoing airway interventions. Let's start with the neutral head position, which serves as the baseline for airway management. In this position, the patient's head is in a natural neutral alignment with the neck, neither flexed nor extended. When positioning the patient's head in a neutral position, ensure it is aligned with the spine and not flexed or rotated in any direction. This position may be sufficient for some patients, especially if cervical trauma is suspected. The sniffing position is considered the optimum position for airway management in adults. This fundamental positioning technique is used to optimize airway alignment and facilitate face mask ventilation or intubation in patients requiring advanced airway management. The sniffing position involves positioning the patient's head and neck to achieve optimal alignment of the airway structures, particularly the pharynx and larynx. This alignment enhances the visibility of the vocal cords during intubation and reduces the risk of airway obstruction. To achieve the sniffing position, gently elevate the patient's head using a pillow or towel roll placed under the occiput, if necessary. Simultaneously flex the neck forwards while tilting the head backwards. This creates a slight backward tilt of the head relative to the neck. In the sniffing position, attempt to lift the ear's external auditory meatus to the level of the sternal notch to align the oral, pharyngeal, and laryngeal axis. This alignment facilitates direct visualization of the vocal cords and improves intubation success rates. A useful aid memoir is ear to sternal notch. Hyperextension can occur during efforts to optimize airway visualization during intubation. It can present several potential issues and risks that healthcare providers need to be aware of. Hyperextension occurs when extending the patient's neck beyond the optimum sniffing position while trying to visualize the vocal cords during intubation. This often occurs inadvertently in patients with difficult airways or limited mouth opening. Hyperextension can lead to issues such as worsening of cervical spine injury, oropharyngeal obstruction, difficult face mask ventilation, and gastric insufflation. Hyperflexion refers to the excessive bending of the neck forward beyond its neutral position. Too much flexion of the neck can potentially lead to complications such as airway obstruction or worsening of cervical spine injury. You may encounter patients whose previous medical and surgical histories have led to a baseline hyperflexed resting airway position. Remember, proper head positioning is essential for maintaining a patent airway and ensuring adequate ventilation during airway management procedures. By mastering these techniques on our Smart Airway, you'll be better prepared to respond effectively to respiratory emergencies in real-life clinical settings. Smart Airway will guide you on the proper technique, with instances of improper technique like hyperflexion or hyperextension.